Hi, my name is Olga. I'm going to be performing the skills video of administrating intradermal injection. Supplies that are needed for this video are 2 alcohol wipes, a gauze, a syringe and needle, a pair of gloves. Next, I'm going to verify the orders in the EHR against the MAR 3 times before giving any medication to my patient. So this is going to be the first time doing so. The syringe that I'm going to be using is that I will be needing for this injection is a 29 to 30 gauge needle, half-inch needle, 1 milliliter syringe. I'm going to be using this one due to supplies. Next, I'm going to go over the 6 rights of medication. Right patient, right medication, right dose, right route, right time, and right documentation. Next, I'm going to calculate my my drug. Basically, patient is going to be receiving 0.1 milliliters per dose. What I have on hand is 5 tuberculin units per 0.1 milliliters. Again, the patient is going to be receiving 0.1 milliliters dose. The medication that my patient is going to be given is called tuberculin purified protein derivative. Next, I will go ahead and gather my supplies here. I will knock, enter, close the door behind me to avoid any HIPAA violations. I will set my supplies here on a clean, dry surface. I will go ahead and hand hygiene here and introduce myself to the patient. Hi, Mrs. Smith. My name is Olga. Can you please verify your first name and your date of birth? As she verifies that, I'm going to check her wristband. This is going to be my 2 patient identifications. All right, Ms. Smith. The reason why I'm here is that your doctor has prescribed, he is wanting you to get a skin test done. It is called a PPD, which is a test, a skin test. The medication that you're going to be receiving is called tuberculin purified protein derivative. The mechanism of that is that it checks the sensitivity of your lymphocytes. It is a skin sensitive test. Basically, we're going to inject that above your, in your dermis, and we will go ahead and reassess that in 72 hours. The use of it is that it helps us know if you have any if you have any tuberculosis right now, or if you had it in the past. Excuse me. Next, some of the side effects that you might be experiencing is itchiness at the site, bleeding, just any swelling. That is normal. Just want to let you know about that. And then you might be experiencing some adverse reactions. We do not want that to happen. So please let me know if any of that occurs. You can have shortness of breath, fever, or a rash anywhere in your body. Next, I want to, do you have any questions for me? No questions? All right, perfect. So then this is going to be my 3rd and last time verifying against the MAR. So I'm going to hand hygiene here, and I'm going to put on my clean gloves. And we're going to get started here. So Ms. Smith, just want to let you know that upon injection, you might feel a little bit of stinginess and burniness. That is normal. So after I let the patient know that, I'm going to go ahead and start with my syringe and my medication here. So again, the needle and syringe we're going to be using is a 29 to 30 gauge, a half-inch, 1 milliliter syringe. We're going to go ahead and take this out. carve that, and we're going to go ahead and hold this as a pencil, needle up, cap still on. We're going to get the 0.1 milliliters of air here. Zero 0.1 milliliters of air. Oh, you guys can see that. Awesome. Next, we're going to get this medication prepared. We're going to go ahead and clean the top of the medication vial, discard that, and we're going to go ahead and hold this like that as a pencil. We're going to take off the cap here. We're going to inject back the air here. And we're going to invert, and we're going to go ahead and draw up the 0.1 milliliters of the solution. We're going to tap if there's any bubbles, and if there's too many bubbles, we would just inject that back and withdraw that again. Bubbles, no bubbles. So 0.1 milliliters. And next we're going to take that out, and we're going to use the smooth method. Close that. Okay, medication is ready to go. Next, we're going to go ahead and we're going to assess the site and clean up the top. So when assessing, we are going to, the injection could be given at the upper arm here, both forearms, or in the upper back. This time we're going to be giving our patient in the forearm here. So we want to give the patient just right here in the area. So it's going to be 3 to 4 fingers above the antecubital space, and then 1 finger, 1 hand length above the wrist. So it's going to be in this 4 area. So this is going to be right there for my patient. Next, we're going to go ahead and clean the area up, and we're going to assess. We're going to assess for any lesions, any skin any skin discolorations, or we're going to palpate for any tenderness. And we're going to grab here our gauze pad, and we're going to start at the center, going outwards. 2 inches out. Start at the center here, 2 inches out. Perfect. And we're gonna let that air dry. We're not gonna blow it or anything like that. And we're gonna take these 2 fingers, take off the cap here. We're gonna make sure that our bevel is up. We're going to go in a 5 to 15 degree angle. We're going to go ahead and go in there. We're going to feel some resistance. I do feel some resistance. I'm going to make sure that it's 1/8 of into the dermis. And I'm going to slowly inject. I do see a small blob, 6 to 10 milliliters, resenting a mosquito bite. I will go ahead and grab my my gauze pad, a gauze pad here. I will slowly get that out, and I will immediately throw this into the sharps container here. I will not put any pressure here. I will gently make sure that there's no bleeding, and we assess that there's no bleeding on there, so no need for a band-aid. And I will go ahead and discard all the rest of this and put this back in there, my medication room. I will go ahead and take off my gloves here, dispose of that. I will hand hygiene here, and I will go ahead and document my results.